helping make your life easier. Moms Every Day.
Watching our small children or other family members scratch and live with itchy skin can be unbearable as a parent. Dr. Petra Razdan is here from Allergy, Asthma and Immunology Associates to talk about the importance of moisturizing the skin and finding triggers that can cause our family to itch. And nice to see you, Doctor.
Nice to see you, too.
And this really can be a problem any time of the year, right?
Oh, absolutely. Eczema or atopic dermatitis is a very common condition, affects up to 20% worldwide, very common in the Western world. And yes, the triggers can be hot, humid weathers or the very dry climates when you put your forced air on in the winter, so definitely all year-round problem.
And doesn't matter where you live, you can have this problem.
Definitely, definitely.
I know as a parent, my little girl, her skin seemed more prone to eczema than my son. Are certain skins that way?
Well, first of all, eczema is a very complex disease. It's related to what types of genes that are dysfunctional and also different mediators that are released by certain cells. And there's definitely a degree of inheritance in this disease.
So what can you do for treatment then?
So I don't think you should underestimate moisturizing. It's extremely important, and it's important to pick something that's extremely high fat content. Don't pick lotions, do creams and etc. And it can spare the child from being exposed to a lot of steroids, both topical and oral, which can have their own side effects. So that is one of the mainstays of the treatment, is to have good hydration for the skin.
And eczema can be very mild, or it can be more intense, more severe?
Absolutely. Sometimes you'll just have these round coin-shaped lesions on your legs in the winter. Then we have patients that have them all over their body, and it interferes a lot with the family's quality of life, and it's very disruptive for their sleep, decreased school performance, and etc.
Lots of complications.
Lots.
From it. Do the children itch it then? It just drives them nuts? Or?
That's actually one of the hardest things for us to treat, is the itchiness or the pruritus. It's a itch-scratch cycle, and we will sometimes have to use sedating antihistamines at night just to try to make the child not scratch their skin.
Gosh, well, what are some common triggers then again?
Well, a lot of common triggers is just extremes of temperatures that we talked about, but also a lot of indoor allergens. For example, you have to do an environmental history, talk about if they have a cat, a dog, in the urban areas, cockroach, and house dust mite, very common. And then you also have food allergies that can trigger this disease as well.
But there is help. You shouldn't worry. You can get it under control?
Absolutely. You know, there's very simple things that you can do, and just having a very stepwise approach towards this and have a plan of action once the child flares. It's definitely a manageable disease. It's difficult, but we can help you guys out with it.
And you can outgrow it?
You can outgrow it, definitely, definitely.
Okay. All right, doctor, thank you for being here today.
Thank you.
Yeah, and if you would like to have more information on atopic dermatitis or Allergy, Asthma and Immunology Associates, you can visit Moms Every Day or download the Moms Every Day app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.